चलो रीड करो लाउडली.
Okay, which of the following is most likely cause of this patient current systemic illness? 43-year-old man come to the clinic due to fever, night sweat, fatigue, and progressive skin lesion. The patient says the skin lesion started as a small reddish purple papule that gradually enlarged to a large nodule. He has a history of HIV and is non-compliant with antiretroviral therapy or prophylactic antimicrobial. His CD4 count 3 months ago was 50. Acha. He has been hospitalized in past for pneumocystic pneumonia. The patient is homeless and primarily live outside, live outdoor, but sometimes stay in shelter. Temperature 38, blood pressure 116/70, and pulse 92. Patient cachectic white plaque are present on his palate. Hepatosplenomegaly is present. Skin examination shows several purple pedunculated lesions on the face and extremity that are friable and bleed easily on palpation. CT scan of the abdominal level, hypodense liver lesion that enhance with intravenous contrast. Which of the following is most likely cause of this patient current systemic illness?
Okay. जी आप क्या अटेम्प्ट कर रही हो?
मुझे तो ये बार्टोनेला लग रही है cause there is some no large nodule ना enlarged to nodule large nodule और ये होमलेस भी है HIV homeless large nodule
सही हो तुम. Skin examination shows several purple pedunculated lesions on the face and extremities that are friable and bleed easily with the palpation. और ये बार्टोनेला के जो बैसिलरी एंजियोमेटोसिस है ये फर्स्ट एड में लिखी हुई है, मुझे याद आ रहा है. और ये नीचे लिखी है डर्मा में, ये ऊपर भी नहीं लिखी हुई, डर्मा में नीचे लिखी हुई है. जो ऑपर्चुनिस्टिक इन्फेक्शन वाला पेज है ना शायद उसमें भी ये प्रॉपरली नहीं लिखा हुआ.
हाँ but in derma bacillary angiomatosis is there
related to purple papule or nodule biopsy with neutrophilic inflammation. एक यहाँ लिखा हुआ है, दूसरा ये यहाँ लिखा हुआ है bacillary angiomatosis catch is correct. तीसरा लिखा हुआ है यहाँ पे असल जो लिखा हुआ है ये benign capillary skin papule patient with AIDS caused by Bartonella infection frequently mistaken for Kaposi sarcoma but has neutrophilic infiltrate. जबकि Kaposi होता है उसमें neutrophilic infiltrate आपको नहीं मिलता और ये चीज हम लोग वो भी करते हैं. ये देखो मैंने लिखा हुआ है Bartonella neutrophilic. ये हम डिफरेंशिएट करते हैं.
And another thing is maybe Kaposi sarcoma it involve the systemic symptom like GI tract respiratory skin mouth
malignancy most commonly affecting skin, mouth, GI tract, respiratory tract, classically seen in older Eastern European males. Patients with AIDS, organ transplant patients associated with HIV, HHV8 and HIV lymphocytic infiltrate, unlike bacillary angiomatosis. कैपोसी में जो आपको मिलता है वो lymphocytic infiltrate मिलता है, जबकि आपको वहां पर जो मिलता है क्या नाम है आपके बैसिलरी एंजियोमेटोसिस में जो मिलता है वो न्यूट्रोफिलिक इन्फिल्ट्रेट मिलता है.
lymphocytic bacillary is lymphocytic ना
नहीं नहीं नहीं
no
नहीं नहीं
sorry I just confused Kaposi sarcoma अच्छा Kaposi sarcoma is a virus that's a virus herpes simplex family so that's why we got lymphocytic infiltrate because in viral infection lymphocyte count is more and bacillary angiomatosis it's a bacteria right
शायद हाँ बार्टोनेला हेंसले
it's a bacteria so we got neutrophilic infiltrate
बिल्कुल. मसला है स्किन लीजन सेम आते हैं ना, इस वजह से ये बता रहा है.
और
मैंने
दोनों
कैंडिडा
एड्स के साथ
नहीं पता, शायद मैंने इसके ओरल अल्सर्स देख के कर लिया, बट सही है, ठीक है, मैं गलत हुआ उसमें भूल गया मैं। ओके, बाटनला हेंसले और क्विंटाना बोलते हैं आपके बैसिलर एंजियोमेटोसिस के ऑर्गेनिज्म को। एपिडेमियोलॉजिकल एक्सपोजर और होमलेसनेस लाइस से भी ये लगता है आपको। जूं जिसको हम बोलते हैं बालों वाली, जूं की वाइफ जो होती है, ठीक है, और लाउस होता है मेल
call
जूं।
it ukun.
हाँ,
We
क्या
call
कह
it
रही हो?
ukun.
हुको?
Ukun, ukun.
हुकोल?
Ukun.
अच्छा,
हाँ.
सही। जुएं बढ़ गई, जुएं हमारे
You
यहाँ से
learn
कहते हैं।
Bangla?
हाँ, मैं बांग्ला सीख जाऊंगा आहिस्ता आहिस्ता, ठीक है। केट
हाँ.
एक्सपोजर, होमलेसनेस, लाइस, सिवियर इम्यूनो कॉम्प्रोमाइज, एडवांस HIV CD4 लेस देन 100 पर mm³ में हमें ये मिलना चाहिए। हालांकि जो CD4 काउंट लेस देन 100 mm³ वाली चीज थी, जहां पर आपके सारी इन्फेक्शन लिखे हुए हैं, ये वहां मेंशन क्यों नहीं था? मुझे इस चीज का दर्द हो रहा है, होना चाहिए था मेंशन। मेंशन है आपा, ये यहाँ पर मेंशन है। बार्टनला स्पेशली लेस देन 100, बैसिलरी एंजियोमेटोसिस, मल्टीपल रेड टू पर्पल पैप्यूल और नोडुल बायोप्सी विद न्यूट्रोफिलिक इन्फ्लेमेशन मेंशनड है, ठीक है। मैंने ये वाला किया था कैंडिडा वाला, बट मैं भूल गया, मैंने भंड मारा। इसमें एसोफेजाइटिस होगी, नॉट के स्किन के मसले। इधर चलें आगे। मैनिफेस्टेशन में वेस्क्यूलर, जाग रही हो ना? ओ आपा, आपा ब्रो, अनम्यूट कर लो। चलो मैं पढ़ता हूँ। वेस्क्यूलर क्यूटेनियस लीजन्स मिलते हैं, पेपुलर, नोड्यूलर, पेडंकुलर, सिस्टेमिक सिम्टम्स मिलती हैं, फीवर, नाइट स्वेट, फटीग, ऑर्गन इन्वॉल्वमेंट, रियरली लिवर, बोन, सीएनएस। डायग्नोसिस में लीजनल बायोप्सी विद माइक्रोस्कोपी और हिस्टोपैथोलॉजी, ट्रीटमेंट में डॉक्सीसाइक्लिन और एरिथ्रोमाइसिन, एंटी रेट्रोवायरल थेरेपी भी देते हैं। 2 हफ्ते बाद मेरे ख्याल से होगा, इसमें भी लिखा हुआ है 2 to 4 weeks later. Bartonella species are gram-negative intracellular bacteria that typically establish infection through cutaneous penetration after a cat scratch, Bartonella hensley, or body or head lice bite. Bartonella quintana बोलते हैं इसको. The organism causes a local dermal infection, spreads to the vascular endothelium, and then attacks red blood cells. The major manifestations of infection are therefore mostly cutaneous, lymphatic, or endovascular. Cat scratch disease, bacillary angiomatosis, endocarditis. Bacillary angiomatosis is a Bartonella infection seen primarily in patients with HIV with CD4 counts of less than 100 per mm³. CD4 mediated immune response is crucial for control and elimination of the organism. Symptoms feature vascular cutaneous lesions that often begin as small reddish purple papule and evolve into friable pedunculated or nodular lesions. Constitutional symptoms, for example, fever, malaise, night sweats, are typically present in organ, liver, central nervous system, bone involvement may occur. Diagnosis is made by tissue biopsy with histopathology and microscopic identification of the organisms. Treatment requires antibiotics, for example, doxycycline, erythromycin, and initiation of retroviral therapy, usually 2 to 4 weeks later. लीजन्स देख लो, ये है आपका बटन लाइन्सली का बेसिलरी एंजियोमेटोसिस का लीजन।
हाँ.
Candida albicans Candida infection is likely the cause of which this patient's oral thrush, white plaques. Invasive disease is sometimes seen in patients with a severe neutropenia, hematologic malignancy, chemotherapy, and may manifest as multi-organ failure. This patient with HIV and angiomatous skin lesions is more likely to have be a bacillary angiomatosis. Choice C and D, cytomegalovirus and disseminated Mycobacterium avium intracellular complex are common infections in patients with advanced HIV CD4 count of less than 50 per mm cube. CMV may cause rhinitis, colitis, pneumonitis, encephalitis, and other organ involvement. Disseminated MAC, Mycobacterium avium intracellular, may often manifest with constitutional high fever, nitrates, fatigue, malaise, weight loss, and gastrointestinal, जिसमें diarrhea and abdominal pain के symptoms. Angiomatous skin lesions are not a feature of CMV or MAC. Angiomatous skin lesions are not a feature of either CMV or Mycobacterium avium intracellular. Nocardia infection typically manifests primarily with pulmonary and central nervous system disease, but the organism occasionally causes cutaneous infections that resemble a bacterial abscess, not angiomatous skin lesion. Pneumocystis cerevisiae causes indolent interstitial pneumonia in patients with advanced HIV CD4 count of less than 200 per mm cube and does not typically cause skin lesions. Vocal holoscum contagiosum is caused by a pox virus. Manifest as skin-colored pearly papular lesions, often with a dimple in the center. Systemic symptoms, vascular nodules, and liver lesions are not features of molluscum contagiosum. Bartonella henselae and Bartonella quintana can cause bacillary angiomatosis in immunocompromised individuals. For example, advanced HIV patients develop vascular cutaneous lesions, systemic symptoms, and sometimes organ involvement. Liver, central nervous system, bone. Treatment requires antimicrobials, for example, doxycycline, erythromycin, and antiretroviral initiation. Okay, ये है परली पैपुलर मोलस्कम कंटेजियोजम का. ठीक है, चलो
And treatment
पढ़ो आगे.
antiretroviral infection. Okay. Which of the following would most likely have prevented this patient clinical finding? Acha, 4-day-old girl brought to the office due to bilateral eye discharge that began 2 days ago and is worsening. The patient mother is 20-year-old woman and gravida to para 2. Acha, just 4-day-old girl, na? And who has limited parental care. Parental care. During the 3rd trimester, group B streptococcal screening was positive. The mother had no additional testing during the pregnancy. Delivery occurred vaginally at home without any non-complication and under the care of a midwife. The parent declined routine prophylactic medication for their newborn. Temperature 36.7. Patient has bilateral eyelid and conjunctival swelling and significant purulent discharge. The rest of the examination is normal. Which of the following most likely have prevented this patient clinical finding? Purulent discharge, no? अच्छा तो मैं तो पिक कर लिया.
बताओ.
तो ये गोनोरिया का केस cause the purulent discharge and we have to give erythromycin for the infant, topical erythromycin for the infant.
सही कह रही हो, पढ़ो.
Okay, transmission, contact with infected genital secretion during delivery. Clinical presentation, copious exudate and eyelid swelling, usually aged 2 to 5 days. Complication, corneal ulceration and scarring, vision loss. Diagnosis, nucleic acid amplification test and gram stain, gram-negative intracellular diplococci. Acha. And culture, thiomartin media. Treatment, IM, 3rd generation cephalosporin, cefotaxime. Prevention, maternal screening, age less than 25 or risk factor and with risk factor and treatment. Acha, if they ask about the treatment, then we have to pick this cephalosporin. IM, 3rd generation cephalosporin. Now they're asking which could have prevented this complication. That's why we choose erythromycin. Ophthalmic erythromycin ointment at birth. Cefotaxime. Cefotaxime is the treatment, and for prevention, erythromycin, eye ointment. This infant severe prudent eye drainage and eyelid swelling in the first week of life are consistent with gonococcal conjunctivitis. Infant acquired Neisseria gonorrhoeae through contact with infected genital secretion. Symptoms usually begin at 2 to 5 days and include significant purulent discharge, eyelid swelling, conjunctival edema. If not treated promptly, infection lead to corneal ulceration, scarring, and blindness. Evaluation of suspected gonococcal conjunctivitis is via nucleic acid amplification testing. Gram stain reveal gram-negative intracellular diplococci, support the diagnosis, and positive culture on Thayer Martin media is confirmatory. Treatment is 1 dose of intramuscular third-generation cephalosporin cefotaxime. Gonococcal conjunctivitis in neonate can be prevented by the following: screening pregnant women less than 25 or risk factor treating their infection. Administration topical erythromycin prophylaxis shortly after birth. Erythromycin prophylaxis. Erythromycin prophylaxis should be given to all newborn, including those whose mother tested negative or were treated for gonorrhea due to possibility of reinfection. In this case, the mother of this infant did not undergo prenatal testing for Neisseria gonorrhoeae and declined routine prophylactic medication for her newborn. Then other option choice A, antenatal acyclovir prophylaxis can prevent maternal herpes simplex virus outbreak. Herpetic keratitis present with vesicular or ulcerative corneal disease, usually in the second or third week of life, finding not seen in this patient. Then choice B, antenatal azithromycin can prevent transmission of chlamydia trachomatis from mother to child, but chlamydia conjunctivitis cause watery or mucopurulent discharge in the second week of life, a timeline inconsistent with this patient presentation. Choice C, interpartum ampicillin prophylaxis can prevent early onset group B streptococcal disease, which usually present as sepsis or pneumonia in the first 24 to 48 hours of life. Although this patient mother tested positive on group B streptococcal screening, and localized infection to the eye as seen in this patient would not be expected. Intrapartum ampicillin prophylaxis for group B streptococcal disease. Okay. Third generation cephalosporin used for treatment of gonococcal conjunctivitis. First generation cephalosporin cefazolin are not recommended for treatment or prophylaxis due to bacterial resistance. Then choice C, oral macrolide. Oral macrolide are not used for treatment or prevention of gonorrhea infection due to antimicrobial resistance. Ophthalmic erythromycin formulation likely provide adequate prophylaxis in newborn due to high local concentration. Educational objective: gonococcal conjunctivitis present at age 2 to 5 days with eyelid swelling, conjunctival injection, and profuse purulent discharge. Erythromycin ophthalmic ointment administered shortly after birth, highly effective in preventing gonococcal conjunctivitis. So several things. One is this patient age 2 to 5 days. Gonococcal conjunctivitis come within 2 to 5 days, and we will get purulent discharge. Conjunctival injection, purulent discharge. And if the conjunctivitis already happened, then we give third generation cephalosporin. Third generation cephalosporin is cefotaxime. Third generation cephalosporin cefotaxime. And for prevention, we have to give oral, topical, and erythromycin. Topical erythromycin as a prophylaxis.
ठीक है. Hello?
It's not coming yet.
आ जाएगा.
Okay. Which of the following is most likely diagnosis in this patient? 40-year-old man come to the emergency department due to 10 days of fever, chills, and malaise. He also noted progressive cough and generalized abdominal pain 2 weeks prior. He returned after a month traveling through Southeast Asia. The patient has no additional travel history. Medical history notable for diabetes mellitus, temperature 38.9, blood pressure 90/50, pulse 114, respiration 26. The patient is ill appearing but is alert and answer question appropriately. Lungs outer coarse, deep breath trigger a non-productive cough. Abdomen soft but diffusely tender with mild splenomegaly. There is an irregular 4 to 5 cm shallow purplish skin ulceration along the right lateral forearm. 4 to 5 cm shallow purplish skin ulceration along the right lateral forearm. Purplish skin ulceration. Chest X-ray show bilateral opacification and abdominal ultrasound reveal numerous 2 to 3 hyperechoic mass with the internal septation in the liver and spleen. Blood culture grow gram-negative bacilli. Gram-negative bacilli. Which of the following is most likely diagnosis in this patient? Okay, I picked my answer. Maybe this one.
तुमने क्या किया था?
Maybe this one, melioidosis. Anthrax is gram positive, na?
पढ़ो.
I'm reading anthrax first. Anthrax is primarily transmitted when human come into contact with infected animal or animal hide. It causes cutaneous ulcer, which tend to be painless and necrotic with a depressed center. Cutaneous ulcer. It also causes cutaneous ulcer, but that is painless and necrotic with a depressed center. Inhalation of spore can cause a fulminant pneumonia. However, Bacillus anthracis is a gram-positive rod. Now option B. I'm reading option first all the option and then. Choice B, listeriosis. Listeriosis primarily occur after ingestion of contaminated food. It most often cause febrile gastroenteritis. Listeriosis cause febrile gastroenteritis in a healthy individual, but invasive disease can occasionally occur. The most common manifestation of disseminated disease is meningoencephalitis, not pneumonia and organ abscess. In addition, Listeria monocytosis is a gram-positive rod. Then choice D, salmonella. Salmonella gram-negative bacilli that can cause enteric fever, which often present with shock, skin lesion, and hepatosplenomegaly. However, the infection usually causes stepwise illness with fever and chills the first week, and abdominal pain and rose spot. थोड़ा सा नीचे करो, rose spot. Then scroll it down. Okay, rose spot the second week. Rose spot the second week, and hepatosplenomegaly intestinal bleeding the third week. Okay, first week just the fever, second week we get this spot or the rose spot, and in third week hepatosplenomegaly intestinal bleeding perforation, serious complication. Cutaneous ulcer and pneumonia would be atypical. Educational objective, melioidosis is a rare infection caused by gram-negative bacilli. Gram-negative bacilli Bacteria pseudomyeli. It is endemic to Thailand, Malaysia, Singapore, and northern Australia. Common clinical manifestation include fulminant pneumonia, cutaneous ulcer, abscess, and organ abscess. Okay, just scroll it up. This patient visited East Asia and developed symptoms consistent with melioidosis, an uncommon infection caused by facultative intracellular gram-negative bacilli, Bacteria pseudomyeli. The organism is endemic to Thailand, Malaysia, Singapore, northern Australia, and is transmitted primarily when contaminated soil or water get inoculated in subcutaneous tissue. Severe disease is rare in healthy individual, but those with diabetes mellitus, excessive alcohol use, or chronic lung or kidney disease are high risk of fulminant infection. Severe disease is rare in healthy individual, but those with diabetes mellitus, excessive alcohol use, or chronic lung kidney disease are at higher risk of fulminant infection. When contaminated, so it's transmitted via the soil, contaminated soil or water. And normally it do nothing, but if the patient is alcoholic, if he has diabetes mellitus or chronic lung kidney disease, then it causes serious complication, fulminant infection. The following manifestation may occur: pneumonia, most common manifestation and usually present with high fever, cough, rigor, respiratory distress, and sometimes shock. Chest imaging typically show bilateral opacity. Skin ulcer or abscess occur in approximately 25% of cases and frequently appear as purple color lesion. Organ abscess in the kidney, prostate, spleen, liver occur in minority of the case. This patient abdominal pain and hyperechoic septate masses suggest liver and spleen abscess. The diagnosis is made by culturing a sample from mucous membrane, throat, rectal, blood sputum, skin ulcer, and organ abscess. Gram stain will reveal gram-negative rod that exhibit bipolar staining with a safety pin appearance. अच्छा, ceftriaxone appearance ना. Treatment requires ceftazidime or a carbapinem for the acute infection, followed by several months of trimethoprim sulfamethoxazole to eradicate the organism completely. Okay, if you want to read, you can read this. This topic is new.
बस
हाँ,
ये
in
कल कर
1
पढ़ेंगे
week.
क्योंकि हमें
कल
समझ गया न्यू
okay,
टॉपिक, बट ये मेरा भी माइंड जो है ना वो सुन हो गया है। मैं रिकॉर्डिंग सुनूंगा अपनी, ये वाली सही है बाद में।
okay.
अभी आई एम
अच्छा,
पूरा थक गया हूँ, आज के लिए बहुत है, बाकी कल करेंगे इंशाल्लाह।
okay, okay.